Welcome, everybody. Nice to have you here. We'll get started in about a minute. And while we wait for everybody to arrive, feel free to start putting in the chat your name, your organization, anything you want to share. And again, we'll start in about 1 minute. Thank you. Okay, I'll get us started. Welcome to Mobile Health Partnerships to Address Protective Health Measures that Prevent Childhood Infectious Diseases. We're happy you could join us today. We appreciate you all for joining us at this time, busy time for you, I'm sure. But we have some wise speakers that will be presenting today. Additionally, I wanted to take a moment to let you know that this session will be recorded, and the recording, along with the slides, will be posted on our website and in additional email follow-up. Before I move on to the learning objectives today, I wanted to review some housekeeping and reminders. You can hear us, but we cannot hear you. We will have a portion at the end of the session for questions and answers. If you wish to have closed captioning turned on, there should be a button on your screen that either says CC or closed captioning. We will also have a set of evaluation questions at the end of the webinar that we encourage you to complete, as it helps us to provide the best content and tailor it to the voices of those in the field. Our learning objectives for today are: we hope that at the end of this session you'll be able to define mobile health, also known as mHealth, and how mobile health services support early detection and management of chronic diseases. We hope you'll be able to identify key champions and successful mobile health collaborations, such as healthcare providers, schools, community organizations. We also wish that you'll be able to understand how partnerships enhance outreach, engagement, and service delivery for students. And finally, identifying how mobile health partnerships can overcome barriers to healthcare access. Now I'd like to let all of our co-presenters introduce themselves. My name is Mandy LeBlanc. I get to be a contractor with School-Based Health Alliance. I'm based in Seattle, Washington, and have over 20 years of experience in school-based health. I'll toss it over to Donnie.
Thanks, Mandy. Hi, everyone. My name is Donnie Greco. I'm an associate here at the School-Based Health Alliance. I've been here for 3 years, and I'm based in Pennsylvania, right outside of Pittsburgh. And I'll pass it over to Shelley.
Hello, my name is Shelley Worstel. I am a senior director with the School-Based Health Alliance. I joined the team last November. Prior to that, I was at Denver Health for 12 years. So I am located outside Denver in Colorado. My first position at Denver Health was actually a patient navigator for mobile clinics. And then I moved into school-based. So when thinking about a great presenter for today, I volunteered my old colleague, Corey, who will introduce herself in a minute, who started with us in school-based and then is now managing all the operations for the fleet of mobile clinics that they have at Denver Health. And I'll pass it to Corey.
Good morning, everybody. Thank you for being here with us. My name is Corey Depew, and as Shelley mentioned, we have worked together for the last 5 or 6 years here at Denver Health, which is a large federally qualified health center system in Denver, Colorado. I serve as the operations manager for our mobile health centers department and oversee a team of about 25 staff and 4 different mobile health units that offer various services, which we'll get to talk about today.
So I'm going to go ahead and kick us off today. What is mobile health, or mHealth? The definition, when you look it up, is the use of mobile technology to deliver healthcare services. When we talk about mobile health, different images may come to mind. This could include utilizing telehealth for remote consultations, could be a healthcare provider who's mobile and meets patients where they're at, or it could be a van that's equipped with medical equipment. The School-Based Health Alliance has a school-based mobile healthcare toolkit that provides a detailed definition of mHealth and also focuses on the last type of mobile health, the vehicles with medical equipment and staffed by healthcare professionals. Today, we will discuss the role of mobile health partnerships in advancing protective health measures for youth, mainly regarding a mobile unit, but sprinkling in some examples of other ways to incorporate mobile health to respond to community needs. And I see Donnie put in the link to the toolkit in the chat if you want to check it out. So, preventing the spread of infectious disease. Recognizing that not every community has the space within their schools, the resources, or the staff to establish and maintain a brick and mortar school-based health center, or SBHC, mobile healthcare can play a vital role in addressing potential gaps in service. Mobile healthcare units can travel to different schools and communities to provide health services on site, complementing and expanding the reach of SBHCs, especially in rural or communities with more limited resources. Later, when we get to the case study portion of this presentation, Corey will talk about their various mobile clinics and how they use them for early detection and rapid testing, and how they are increasing access to healthcare by coming directly to patients. Before we begin, we would like to learn from you. When you think of mHealth, what are some innovations you are seeing in your communities? Please go ahead and drop any thoughts in the chat. And I'll take a minute to see what we might be seeing. Anybody? Nobody seeing innovations in your communities? Mobile vision, vision to learn, dental screenings. I'd say mobile vision and dental are some very common ones. Expensive equipment and being able to get them to more patients. More mobile dental. Mammogram. That was the one that I started on at Denver Health. Telehealth visits for acute issues. That's great. School and sports physicals, behavioral health. Love that. All right, I'm going to move on, but keep these coming. And we'll see if tooth taxi. I love the name of that. Okay, the need for mobile health in keeping youth healthy. As mentioned previously, mobile healthcare units provide essential health services to school-aged children directly at schools. Much like SBHCs, mobile health clinics are designed with the specific needs of each school and community in mind. These units can work independently or in partnership with existing school-based health centers, making them a flexible and valuable resource. By offering customized care, mobile units help meet the unique needs of students, families, and communities. They also play a key role in preventing the spread of infectious diseases and improving access to preventative care. Today, we'll focus on school-based mobile health programs and partnerships and best practices for school-aged children and adolescent populations. Health center and health center lookalike staff can strengthen partnerships, increase access to quality health care, and improve rates of protective health measures. Key collaborations. Each mobile healthcare program is unique and tailored to the specific needs of the specific community, much like I said on the last slide. And tailoring requires consistent updates and assessment. Building a network of key collaborative partners to enhance your mobile healthcare's vision and champion the work is necessary to achieve a successful school-based mobile healthcare program. Some of these key collaborators are listed on the screen. Mobile healthcare staff can engage partners and collaborate across sectors to build buy-in and support for mobile healthcare services. Ongoing conversations and collaboration is necessary to ensure that the care they're providing is the care that is needed. So, what are mobile health partnerships? As mentioned on both the previous slide and this slide, there's many collaborators and partners for mobile health. Again, in the chat, can you add some other general organizations to partner with? Who may be some unexpected partners who may not typically come to mind? And while we wait for some responses to come in, I would like to add there's a robust list of promising practices for partnerships in the toolkit, that same link that Donnie dropped in earlier. Local hospitals, health departments, cultural nonprofits that can help with consent translations and cultural context for their clients, well-established leaders in the communities. That's always a great place to look for partnership. Some successful mobile health partnerships I have seen are utilizing a utility van to pack in dental equipment. A lot of people mentioned dental equipment, and going school to school to provide dental sealants to youth in schools, or partnering with school nurses and Head Start centers to provide an urgent care telehealth program. So slightly different from the mobile healthcare van, but still having mHealth. And setting up preventative treatment clinics for school staff and community members to walk in for preventative services. Faith-based leaders, that's another great partner. Overcoming obstacles. Funding and resource limitations. Depending on the volumes you see, will affect what additional funding need to be secured. So it's always nice to start with a grant at the beginning of your program, of starting your mobile clinic, so that as you build up capacity, you don't have to stress so much about getting so many visits right off the bat to cover your costs each day. And it kind of gives you a little cushion to start building up that capacity. And it kind of brings me into the second point of letting families know that you're around. So immediately, people may not know what services are offered on the mobile healthcare unit. If you're serving youth, you will have to figure out the parental consent and including parents, families, guardians in children's visits and just questions. And then that intersection between health and education. So navigating HIPAA compliance and school policies, which include FERPA, the Family Educational Rights and Privacy Act. So just knowing who you can talk to, what you can share with the various partners if you are partnering with a school. And then the one I love to talk about is the physical mobile health challenges. So there's the actual upkeep and the staff recruitment portion, which sometimes can be challenging depending on what staff are looking for. They might be going to different locations throughout the week, may have longer days, shorter days. So just making sure you hire staff who are flexible and meet the needs of the healthcare unit. But then also considering the locations that have space for you to park. Some mobile clinics are large and there might not be parking available, or you might not be able to stay there all day. So just keeping that in mind, and also the mobility of your patients. So one of the Denver Health mobile clinics, it has really steep steps to access. So that's always a question that is asked when Corey's team schedules for that mobile clinics, but especially they're asked if people feel comfortable walking up a set of steep stairs. And then think about other physical limitations for your mobile healthcare unit, and if you may need to make alternative arrangements if it's not fully accessible to all. Again, I'm going to keep mentioning the toolkit, but there are some promising practices in the SBHA Mobile Healthcare Toolkit in their operations section for key considerations when working with a mobile healthcare vehicle. Sustainable strategies for mobile health. So sustainability is always a goal for any program, but there are unique challenges for school mobile healthcare programs. The answers will be just as unique as the communities each mobile unit serves. Much like brick and mortar school-based health centers, sustainable strategies include 3 domains: a sound business model, strong partnerships, and high quality practice. Create a sound business model that relies on a variety of stable and predictable funding sources. Diversity of funding is vital and can include grants, in-kind donations, as well as income from billing for services. Strong partnerships. I've talked about this a bit already, and I'm sure Corey will as well. But develop and nurture those strong partnerships with school and community leadership, the other partners you put in the chat, faith-based partners, well-known leaders in your community, those who are committed to school health, and this will help continue to drive business to your practice. And then lastly, high quality practice. Delivering services using best practices and evidence-based tools with integrity will ensure a solid foundation for sustainability. This includes having a plan for data collection and reporting so that you're able to highlight and share the results of your program. By being intentional about data collection and what you're asking of your program, that can help ensure that you speak to all your partners. When you share with your collaborators the data collected through various avenues, such as qualitative, quantitative, or just through great storytelling, you communicate the value and benefit of the school mobile health program. Action steps and implementation. So before I turn it over to Corey to talk about mobile units in action, I would like us all to pause and set aside some time to think about who you may be able to partner with. What existing resources are in your community already in regards to mobile health? Feel free to drop these in the chat or just jot them down for yourself to look back on as you may pursue implementing mobile health. Let's see if anybody wants to share their thoughts. There's a post about telehealth partnerships. Telehealth is a great use of mHealth. We've partnered with FQHC to facilitate school-based and mobile services to 53 sites. Love that. All right, we'll let you keep dropping these into the chat, but now I'm going to turn it over to Corey to talk a little bit more about Denver Health and the fleet of mobile clinics that they have in the community.
Great, thank you, Shelley. Donnie, do you mind going to the next slide? Perfect. So as Shelley mentioned, I'm really here to do kind of just a deep dive into one of our mobile health units that recently launched as a school-based health center in the last year. But before we jump into that specific mobile unit, I wanted to just give an overview of our mobile health centers department here at Denver Health. So the mission of our mobile clinics is really to deliver care directly into communities and reduce common barriers to care. You know, one that comes up really frequently for us is transportation. We focus on serving individuals that have historically had less access to care. And we do this through multiple programs available at Denver Health. It was great to see in the chat all of the different, mHealth innovations that you all are seeing in your communities. And I think there's a lot of crossover from what you're seeing from, in addition to our program here at Denver Health. So The first mobile unit that we have, it's called Mobile Health Center 1, is our cancer screening unit. It's our flagship clinic and has actually been offering services in the Denver metro region since 2002. Historically, it's offered mammography services, and now we have both 2D and 3D mammography services available on that unit. And then we recently expanded to also offer cervical cancer screening as well. So what's great about this is that many women that are eligible can actually receive both breast and cervical cancer screening on the same day, which is a great patient satisfier. And then we have two other mobile units that are a little bit newer, have been around since 2021. And those units offer primary care services. We have one unit that focuses primarily on adults, many of whom are new patients to Denver Health, and many that have not been seen by a doctor in many years. We have a bunch of different partnerships throughout the metro region for these services, but some locations include halfway houses, homeless shelters, cultural centers, food banks, churches. Local businesses have also been kind of a unique partnership for us to explore as well. And then the unit that I'll be kind of doing a deep dive into today is Mobile Health Center 3, which we launched in January of 2024, and rotates primarily to Denver public schools, those that do not have a school-based health center on site. In the summertime, we partner with summer camps and like local nonprofits that are serving youth. And the emphasis with this unit is really preventative care, well child checks, and then of course, acute care when needed. In addition to kind of our standard services, I also just want to highlight one of the great strengths of mobile health units, vehicles specifically, is that they're able to be deployed during local emergencies. And so we actually have utilized our mobile health units for various local emergencies over the course of the last 5 years. Okay, great. So the unit that I want to talk with you about today is called Mobile Health Center 3. As I said, we really focus on preventative and primary care services for DPS children as well as their family members. So one of the benefits of this unit is that we did expand care to serve parents or, like I said, family members of children that are in DPS. And so this has been a nice sort of branching out of us to reach a different community as well. What was unique about this collaboration is that it was really led by local leaders in our community and identifying that more healthcare services were needed in our schools across Denver public schools, not just at our school-based health centers. There were large numbers of new students enrolling into the district that had less access to care. And so our leadership here at Denver Health and at Denver Public Schools basically came together, worked to the foundations that we have at both organizations, worked to raise the funds to begin operating this unit, which was really exciting. So Shelley spoke a lot in the beginning about partnerships and the value. And I think that this is just one great example of key stakeholders coming together to solve a local issue that involves, deploying a unit for mHealth services. So what you can see on these slides is a little bit of information about our eligibility criteria. Unfortunately, we do not have a wheelchair accessible entrance on any of our mobile units. So we do require that patients or members of the community can walk up 4 steep steps. We also only offer services to individuals that are older than 2 years of age. This is just due to limited space and equipment needed for care for those under the age of 2. We see, and then it says who can't be seen, again, patients with mobility issues, and then anybody that is not connected with our Denver public school community. As far as where we serve, I will, define our Denver Public School hubs, but we have 6 different community hub locations across the region. And so where we initially started offering services is at these hubs, and then we've also expanded to offer care really at any DPS school that's requesting services and does not have a school-based health center on site. This is really just kind of a high-level overview of the services that are provided on the mobile unit. When I am out and about describing it to others in our communities, I really, just refer to it as a school-based health center on wheels if I'm in a school system, or, a fully functioning clinic on wheels. And like I said, with these services in mind, we really want to focus on preventative health services, connecting folks to longer-term care, and ultimately keeping people out of the ER or the urgent care. When we talk about our mobile health program here at Denver Health, we consider it to be a bridge to other healthcare services. So we are oftentimes reaching patients that are new to Denver Health and have not yet been seen. And then along the way, we are connecting them to care at more of a true medical home within the system, whether that's at a school-based health center or one of our 10 community health center sites in Denver. Here is a little bit of information about the cost of services and our insurance requirements for the mobile units. Shelley obviously spoke about some of the challenges with operating mobile health units and really, working in healthcare general, and funding is obviously one of those things that come up. But one of the benefits of some mobile programs is that they are able to care for individuals regardless of insurance status. Here at Denver Health, our cost for services does vary between each unit. And that's just because we have both operational funds and then we also have grant funding. And so those 2 funding streams together basically impact our ability to bill or not to bill for services. But for Mobile Health Center 3 and in the schools, we really wanted to market ourselves as an extension of the school-based health clinics. I'm not sure, the school-based health clinics have been a resource here in Denver for over 30 years and are really viewed as a trusted partner. And so, even though we're separate departments, we really wanted to connect ourselves to the school-based health centers as we started our program. So in order to both, reduce confusion, improve access, and ultimately build trust with this community, we felt it was essential to offer care at no cost to DPS students and their siblings, which is the same practice that's used in our school-based health clinics. For adults, it's a little bit different. So we really encourage, individuals to enroll into some sort of health insurance program or discount plan. But for these services, we will offer care to a Denver County resident that's connected with DPS if they are truly uninsured. So that has been definitely a benefit of our program to reach more. And as you can imagine, there are patients that have hesitations about receiving care on a mobile unit. So we really try and do a lot of education with our community partners to really highlight the privacy and the convenience of the mobile health unit. We educate our partners both within our Denver Health system, such as our community health center staff, who can oftentimes be great spokespeople for the services that are on our mobile unit and can really speak, firsthand to having been on the mobile unit, maybe even received care at some point. And so they can be that trusted resource for patients to educate them about our services. And again, by referring to our mobile units as an extension of our community health centers, we really try and highlight how, care is still high quality, even when it's offered on the mobile health unit, just as it would be if it was offered in our brick and mortar clinics. Okay, so I'm sure I touched on the community hubs, and I'm sure folks have questions about what they are. This is an amazing local resource here in Denver Public Schools. And really the Denver Public Schools hubs have been a key collaborator with us in the success of this program. So community hubs are part of the local school district, but they reside in the Department of Family and Community Engagement within the district. And so the mission of these hubs is really to serve the entire family to ensure success, both for the children and for their family members. The hubs offer assistance with basic resources such as housing, health insurance, helping families pay electricity bills and things like that, connecting them with internet access. But you can see also that they offer much more extensive services such as GED classes, English language learning classes, employment support. They offer computer and technology classes. And then in addition to that, they will also offer childcare during these class times. So it's really just a great wraparound resource for families that are within the DPS community to get connected to their most basic services, but also be able to engage on a road that takes them into potentially better pay, job placement, better employment opportunities long term. And so one of the things I want to highlight about the strength of our mobile health program, and this is really just another great example, is that when we are looking to identify key partners, we are often thinking about how can we co-locate essential resources. So I mentioned in the beginning that we partner a lot with food banks or other resource centers, and this is because these are locations that families are naturally already going to for services. And so by locating the mobile unit into those spaces, it's not only creating visibility and broad connections to this community, but it also helps to build trust with these communities, which is an essential component of mobile health programs. So one way that we do this is by partnering with organizations who have already done a lot of that trust building with communities by offering various resources. This is just a map of where we offer our services. And so I'm going to kind of talk you through the key here. It might be a little hard to see, but the yellow spots, they have an apple in the middle, and those are our 19 school-based health centers. And then our main campus is that big orange dot in the middle. And then there's like a light blue indicator, and it has a cute mobile van drawn on it. And that is the primary locations for our Mobile Health Center 3. So like I said, this map only has the 6 community hub locations because those are like stable locations that we go to on a weekly or on a monthly basis. But over the course of the last year, we've also expanded to over 30 additional schools within the DPS school family. So I think the hubs have been an essential part of really connecting us to other schools that need services. You can see here on this map, like there still are areas where there is less access to healthcare for individuals. And so by deploying our mobile health unit, we've been able to reach some of those hard to reach areas. So I wanted to share this slide because I think scheduling practices for medical appointments can certainly be challenging for individuals and communities, especially those who might be unfamiliar with technology, and especially as we move, further and further into this reliance on technology. We really do try to make all of our mobile health programs accessible to patients from a scheduling perspective by offering multiple ways that they can enter into the system. So we have phone numbers that patients can call. We do have online scheduling as well. And then we also have scheduling that can exist directly through a community partner, which is what we utilize here with the community hubs. So the hub staff members basically handle all of our scheduling for the mobile health unit. They work to get the schedule filled in advance of, each of our visits. They are, that direct connection to a lot of families within the system. And so they conduct outreach to families who might be due for services, or, as they're helping families with other supportive services, offer these services as well. So here's just a little bit of data about our first year of service. So this is just from 1 year, and we saw 695 patients on the mobile unit across 824 visits. So I think that, first of all, I think that's for those of you, I know many of you are involved in school-based health centers, and so perhaps you've even launched a school-based health center before. And I think, reaching almost 700 patients in the first year is a testament to the really strong partnerships that we have here with DPS and with the hubs. Additionally, we saw people for multiple visits. So I think, we were building trust with these communities as they came to us for services. From a payer source, you can see that the vast majority of these folks were self-pay or uninsured. We have seen that number increase a little bit we have seen the number of patients who are on Medicaid increase over the course of the last year. And part of that is due to Medicaid expansions in our state for children. And then the other thing I wanted to talk through on this slide is the breakdown by age. So you can see here that ages 0 to 9 encompass the largest part of our population on the mobile unit with 42%. Our school-based health centers are located primarily in high schools and a few middle schools. So I think that this slide really just helps to highlight how we were meeting a unique need in the community by focusing our care mostly in elementary schools and then also early learning centers as well. And then also about 30% of our patients were adults. And I think, at least for us in Denver, it is oftentimes more difficult for adults to access care because we do have this large network of school-based health centers. And so we hear that a lot from our community partners that we can find care easily for the kids, but we struggle to find an entry point for adults. And so this is also meeting that need. Okay, so on the topic, I think this is my last slide. So on the topic of partnership engagement, like I mentioned earlier, we really try to make our services as readily available to any partner within the community that wants to utilize our services. We have a partnership request form that exists on our website that's really simple for folks to fill out. But of course, we also take, word of mouth referrals, or sometimes we just get cold calls or cold emails, which we respond to. But we use this community partnerships form to essentially track any incoming requests that we are getting, how many of those requests are we able to meet, et cetera. We have a standard process for engaging with each community partner, which typically includes an introductory educational meeting where we'll walk them through all of our services, all of our eligibility criteria, scheduling requirements, who can we serve, et cetera. And then assuming that they want to move forward with, booking a mobile health center event, we will then do an in-person site visit. And then we will meet again with the community partner, usually leading up to the event. And then oftentimes we will do a debrief after the event. For our more regular, consistent partners, we typically do quarterly check-ins with those community partners. And then in addition to this partnership engagement form, this year we launched a partner satisfaction survey that we have been disseminating to one-time partners and then our consistent partners on a regular cadence. And so this is nice because it allows our community partners, I think, to be a little bit more honest and upfront with us about some of the challenges of our program. But also, gives them a space to kind of provide clear and direct feedback outside of an in-person meeting. And I think this has really allowed us to have even more open communication with our community partners about how we can improve our services, how we can better engage with our key stakeholders to ensure that we're meeting their needs and ultimately better serve the community of Denver. Okay. I did see a couple questions pop up in the chat, so I know that we'll get to those. So now I would invite you all to write any other additional questions in the chat, and then I will pass it back to Mandy for our last couple slides. Thank you.
Thank you, Corey. Great job. I get to wrap this all up and let you know that I'm going to put a link in the chat for our mobile healthcare toolkit. And wanted to let you know that our mobile health partnerships can address protective health measures to prevent the spread of infectious diseases as well among school-aged children. And we focus on school-based mental health programs and partnerships today, as well as care coordination strategies, best practices for school-aged children and adolescent populations. Again, this will be recorded and we'll send this out because we gave you a lot of information. Corey did a really amazing job of highlighting one success story. And we'll get to your questions in just a moment. But first, I'll ask Donnie to post the poll, which will allow us to learn how we did today, see what we could be doing better. So we'll leave this poll up for a couple minutes, and it really helps us with our evaluations and ongoing improvement. It's just 5 questions, if you wouldn't mind doing a quick answer for us so that we can continue to improve. We'll give it another minute or two to get to the questions part, but I can let you know that if you haven't done it and you do it, that will help us expedite getting to the questions part. Okay, we'll leave it up another minute, but while we do that, if possible, we can get to how to stay connected with us. So we have a QR code here that you can look at to get to our Facebook, Twitter, LinkedIn, Instagram, and other topics. And you could also go to School-Based Health Alliance, where we have a search area where you can type in mobile health. And we'll give it just a little bit longer on the poll. I'd like to see a few more people complete it. The teacher in me wants to hit 100%. So we'll just give it another minute or two. But while we leave that up, Corey, if you're ready, I'll start with some questions that we got. The first question comes from James, which is, does this program break even, generate a profit, or lose money?
That's a great question. Shelly and I are numbers.
Corey, you muted.
Okay.
Okay, sorry about that. Everybody can hear me now? Okay. I said Shelly and I are numbers nerds, so we love talking about the financials of our programs. For Mobile Health Center 3, I would say that generally it's more on the side of breaking even or potentially losing money. We are currently almost entirely reliant on grant funding for this program. And part of that, is because of the the high number of uninsured patients that we're seeing, which, like I said, has continued to go down. So I would say within the first year, it's more on the side of losing money. But now that we get into the second year of service and we're seeing more patients enrolled into Medicaid or other discount programs that help cover the cost for their services, we're starting to see a little bit more of a break-even model. However, I think mobile health programs generally are always somewhat reliant on grant funding. So like, for example, our Mobile Health Center 1, we do receive state and federal funding for that program specifically to deliver care to the uninsured. So I think mobile health programs are always going to be somewhat reliant on grant funding, though we have done some creative things to improve our bottom line and see more patients. One example is in the last 6 months, we've launched a telehealth program. So where we are physically located in a community-based location, which tends to generate lower number of visits than a brick and mortar clinic. We've also added about 3 to 4 telehealth appointments to our templates, which can be current Denver Health patients receiving care. And so that has allowed us to kind of diversify our model a little bit and serve more patients, even though we are still in a community-based setting.
Corey, I want to add too, if you want to speak about it, I don't have to, but to remind you about how you guys have shifted to hiring like multi-dimensional positions. So a driver who's also a medical assistant.
Yeah. So our mobile units typically just operate with 2 staff. I think a lot of mobile units tend to operate with 3 staff. But we have all of our drivers of the mobile units are dually trained as CDL drivers in some cases, depending on the size of the vehicle. They're trained medical assistants as well as patient access specialists. So I do think that allows our costs to remain low as well.
Great. I want to jump in. We've got some more questions coming in. If you've raised your hand, if you could put the question in the chat, that would be the best. Then I'm going to go in order because I see somebody has a Q&A and we'll get to that as soon as we can. But I'm just going to stay in order of the questions, which is, are the hub staff school district employees?
Yes, the hub staff are school district employees.
Great. Okay. Are the community hubs the same as community schools? Do you have community schools in Denver?
So I actually had to look up community schools real quick while that question came through. So I'm less familiar with that term community schools, but the community hubs exist within our Denver Public Schools school district. And it seems like when I Googled community schools, that might be potentially schools that exist outside of the district. That are maybe run by nonprofits. And so we do have community schools here in Denver, one of which is a program that we actually collaborate with. It's called Vive, and they support typically families that are living in shelters before their students have actually enrolled into the local school district. So that is a place where we also offer our services.
Great. I'm going to ask a question from the Q&A, which is that Kristen has been looking at using mobile van for prevention-based events. How have you been able to follow those rules in storing such prevention-based tools? And how have you done any events like this or any advice?
Do you mind repeating that question, Mandy? I just want to make sure I'm understanding it correctly.
Kristen has been looking at using a mobile van for prevention-based targeted events. How have you been able to use certain rules? I think they're called VFC rules in storing the prevention-based tools on the van. And have you done any events like that?
Yes, we have. There are a lot of restrictions around, those VFC and those prevention-based tools. We have been able to get our state health department on board with us storing certain prevention tools on the mobile unit. Although I don't think that they are super pleased with it, and they would prefer that we actually store it in a brick and mortar site. But we recently had our annual audit, which we passed. So for now, we are storing them on the unit, but we do run into challenges, like especially if we have to take the unit to go get maintenance or things like that. We have to, remove all of those supplies because it's not going to be running on a generator or, power.
Great. Wonderful answer. Thank you. We've got a couple more questions coming in. Do your vans require CDL drivers or can anyone drive the vans?
This is something that we are actually looking to change right now because historically we have required the CDL licensure for our drivers, but it is not technically a requirement for the size of our vehicles. So what I will say though is that you do not need to require a CDL to drive certain size vehicles, but we have found that when we are training people to operate these vehicles, they have greatly benefited from attending the CDL licensure training. Here in Denver, it's typically a week long. We pay for it typically either on our grants or on our operations budget. And I think it has really led to some of our drivers just having a lot more confidence when they're out on the road. So not required, but I think definitely enhances the skill and the confidence of your employees.
Great. And two people have asked to see the driving job description. If you're able to, we can get you those email addresses and the email would come from Corey. And so we'll keep track of those. So two people have asked for that. We could probably put that in an email follow-up as well, because I imagine if two people are curious, more people might be curious. Any other questions that have come in? More people want to see the job description. Yeah.
And I am totally available if people have other questions and want to reach out to me via email. If you have, really like specific questions, I'm happy to talk those through with you.
Great. We have a few more moments, so you can either depart from our webinar now, or if you have some other questions, you can continue to put those in the chat. We want to make sure we get as many of your questions answered as possible, and we will stay on for the next 9 minutes in case anybody has questions. You are still on mute, so chat is the best option. Thank you. If you don't have any other questions, you're welcome to jump off into the rest of your day. And if you do, it looks like we do have a follow-up. To verify, the hub employees who are the school district employees are the ones helping with the scheduling of the mobile clinics?
Yes, they are the ones that are helping with the scheduling. I think, when we think about, we really want to have champions in our schools that can help support with connecting families to care. I think sometimes we find great champions in school nurses, but I think also the school nurses are constantly getting pulled in different directions. Like it can even be hard to, schedule a 30-minute meeting with a school nurse. And so the hub staff have a little bit different of a work pace and work environment, and kind of like an open door policy at the hubs where families can just kind of knock on the door and enter in. And like I said, they can get access to food there, they can get access to clothing. And so we have found that, because they're offering these supportive services to families, it's been fairly, simple for them to also kind of add this to their plate and help schedule patients for us.
Great. We got another question in that's, are your medical providers all employees of Denver Health, FQHC?
Medical providers are all employees of Denver Health, and all of our mobile units are considered federally qualified health centers as well.
Great. And another question coming in, what are hub staff? Are these social workers, nurses, etc.? Do they have access to the organization's EMR, electronic medical record, to schedule appointments directly?
The hub staff are not social workers. They're more probably like along the lines of community engagement. I think that they only hire staff that are bilingual for those services, and probably have, a diverse range of educational backgrounds. They do not have direct access to our electronic health record to schedule appointments. What they do is they house the information on a Google Excel file, and then they share it with us. We have a data privacy agreement set up with the school district here, and so that allows for a little bit more ease of sharing back and forth between our organizations. But so they send us the list for patients for us to add into our EMR. However, we're launching a new program here coming up with a nonprofit that serves single parent families, and we are introducing something called widget scheduling, which is where a community partner can actually directly schedule an appointment into the EHR for a patient. They don't technically have access to the EHR, but it's like they would, like a patient would schedule an online appointment. The community partner is able to do that for this potential patient.
Great. Wow, that's innovative. Any other questions for those of you that are still joining us? If you don't have any other questions, you're welcome to move on with your day, and we will stay on for another 5 minutes. When the vans are at schools, do you require appointments or are they just available as needed?
We almost always have walk-in availability, but we really try and have, really, if we're doing any community-based event, we really try and have pre-scheduled appointments. Kind of on the topic of finances and making sure our program is sustainable. Especially with our primary care units, we have APPs on the unit, which are a little bit more expensive. And so we really want to make sure that we are busy and that clients are utilizing the services wherever we are. So typically when we work with a community partner, we ask that they fill a minimum of half of the available appointments. So for a half day, that's typically like 8 to 10 primary care appointments. We ask that they would fill 4 to 5. Sometimes they knock it out of the park and fill all 10, but we do, allow for flexibility for walk-ins too. We just haven't found much success with doing like a walk-in model only.
Great. Oh, another question. Do you create modified registration forms to allow for quick chart creation?
That's a great question. And no, we do not do that currently. They kind of, the patient access specialist has the patient sitting right here and they're just creating the chart in real time. Or sometimes if we get, that patient list ahead of time from a community partner, we'll do pre-registration the day before or 2 days before the event.
We probably have time for 1 or 2 more questions before we all have to go on with our days. Any other final questions? And if not, you're welcome to say goodbye and head out for your day. Maybe this is meant to be our wrap up and taking a few breaths before we jump into the next thing that we all have to do. So thank you all for joining us, and we'll see you later. If you're still on, feel free to write any last thoughts you have, and we'll stay on for 2 more minutes.